Another condition that I often encounter and deal with are what we call recurrent Apthus stomatitis or Apthus ulcers, and you may know them if you're a patient as canker sores. So patients will have these sore ulcers in their mouth, and those are pretty common, seen up to 20% of the population. And oftentimes patients will start getting them in their late teens, early 20s, and they'll have maybe 1 to 6 very painful small ulcers of their oral tissues. And typically these will recur over time, maybe once every few months, a couple times a year. If the patient has severe canker sores, they may get them every month, and they're dealing with this as a chronic problem that can be very painful. They are small, typically less than 1 centimeter in size, but the pain is abnormal and extreme for the size of the lesion. And these are lesions that you'll see on what we say the non-keratinized mucosa in the mouth, such as under your tongue, the floor of mouth, or your cheek mucosa. And so you'll notice like a little yellow or white ulcer with a red halo around it, so that we call it a halo, but red zone around it. Studies have shown that the most common causes are nutritional deficiencies, genetics, or stress. So patients who are deficient, that's the nutritional deficiencies, patients who are deficient in iron or folate or vitamin B, different types of vitamin Bs. Also, another cause is the sodium lauryl sulfate in toothpaste that makes it foam up. It's just kind of an allergic reaction. Foods such as cheese or chocolate in some instances, or some fruits, it's variable. Every patient can have a different cause. Given the prevalence of them in the population, it takes a little bit of investigating to figure out the cause in each particular patient, and that's, as an oral pathologist, what we specialize in. And so we can manage those by trying to figure out the cause of the canker sore. To identify the cause of the canker sore, we have to take a detailed history, get a history of the ulcer, of the sore, how long they've had it, have they changed medications recently, have they started a new food recently, have they been using, what kind of toothpaste do they use? So we have to ask the right questions then to try to get to the cause. And then once we have the cause down, then we can manage if necessary with medications to help the patient get relief. But oftentimes, just by identifying the cause and avoiding it, typically then they won't develop these ulcers moving forward. However, some patients, they just get them for genetic reasons, or they just have, sometimes it's really difficult to identify the cause, and then we will manage those medications in the same way that I manage the oral mucosal diseases, like with the steroid rinses, steroid gels, or even steroid injections if need be.